So in this video, I'm going to introduce you to your main second year topic, which is clinical psychology. You've got two applied topics in year two, clinical and criminal. So we're going to start with clinical, which is the really big one. So let's start off by thinking about what clinical psychology actually is. Well, it's concerned with the assessment, the treatment of mental illness, abnormal behaviour, and psychiatric problems. It's been around since the early 20th century. So what do clinical psychologists do? And here I'm talking about the UK. So they do assessment, diagnosis of treatment, psychological disorders. They do court testimony. They teach and conduct research. They do drug and alcohol treatment. And they administer programs to treat and prevent social problems. They work in lots of different settings. Here are just a few. The NHS in inpatients and outpatients settings. Privately, they can also work in prisons within the justice system. So there's lots and lots of places that you will find them. So how are clinical psychologists trained, and what about psychiatrists? And again, this is UK. So clinical psychologists have to do a UK BPS accredited first degree in psychology. They then have to complete a doctorate in clinical psychology. It takes about 3 years. And alongside all of that, they need to do extensive work experience in the area. Psychiatrists are different. They're trained doctors who then complete further training in psychiatry afterwards. Basically, psychologists focus on psychological therapies and explanations, whereas psychiatrists focus on biological therapies and explanations. However, there's quite a lot of overlap in this country. So from the start, I want you to think about clinical psychology as a sensitive topic, one that you need to be careful with. And what I'd like you to do is think about some of these issues and jot down your thoughts. There'll be a pause button that will be drawn eventually at the end of this slide to help you a little bit. But these are issues and prompts really for you to think about and think quite carefully about what is it you think these things are? What is your opinion about them? Is mental illness more biological or psychological? Which one is it? Is it both? How do you treat it? Some really controversial ideas. When you come to the NHS budget, what are you going to pay for? You're going to pay for the physical health, you're going to pay for psychological health. Where are you going to put the money? And something else that's really quite controversial is, where do you treat mental illness? Do you treat it at home? Do you treat it in a secure unit? Where do you put people? How do you help them? So press the pause button, squiggle your ideas down. Discuss them with somebody else. What I'd like you to really get the idea of now is that anyone, doesn't matter who you are, can have some form of mental illness in their lives. And it doesn't matter who you are, and it doesn't matter where you come from. So some UK statistics. This is from the charity Mind, who you'll find online. So 1 in 4 people in the UK will experience some form or kind of mental illness or health issue in their lives. Well, if you think about the UK population of last year, about 66.65 million. So that's about 16, 17 million of us who might experience an issue like that. So let's have a look at some specific issues and illnesses that mind identify. Now, how you categorize these depends on how you're going to identify illness. But generally, let's have a look at this. The population, there it is, 66.65. So we're going to work out what those percentages are actually in terms of people. So let's start with generalized anxiety disorder, which, as you can see, is 5.9%. Well, that's actually about 3.93 million people. So hit the pause button and see if you can work out what the others are. What percentage of the population might suffer from schizophrenia? Bearing in mind it's 1 to 2%. What percentage might have phobias? So think about some of those things, work it out. If you want to find out more about clinical psychologists in the UK, there's a link here that you can visit that tells you a little bit more about it, a little bit more about their settings, about their job roles. So what does the syllabus look like? Well, it looks big. It's the easiest way to explain it. It's a large part of paper 2. So 54 out of the 90 marks. The rest of the marks are to do with criminal psychology. And notice how much of it there is. We've got to look at schizophrenia, depression. We've got to look at how to diagnose illness. We've got our key issue there. Here we've got 3 studies here, 1 classic and 2 contemporaries. And we've also got a content analysis in our practicals. And underlying all of it, we've got issues and debates. And it's a core thing that you need to get your head around. So hopefully this gives you a feel for clinical psychology, gives you a feel for the kind of things you're going to be looking at and the issues that you need to start thinking about a little bit.